Okay, are you able to see my screen?
All right, thank you so much. And thank you, Alex and team, for having us here today to talk about personal emergency accommodation plans, lovingly known as the PEAP. And it's, of course, the purpose is really to ensure the safety of every student. We're in education, we're talking about students, but as you can imagine, the safety of everyone on a campus, that includes you and anyone who might be visiting. So having these conversations impacts all of us. I am Deb Fitzgibbons. I am so-called retired. I'm failing at it, but I held for the last 9.5 years. I was the regional and statewide services for students with orthopedic impairment. The coordinator for this program and for the Oregon Technology Access Program. And both of those are grants through the Oregon Department of Education and really impact students with, are impacted by the provision of services for our students to make sure that they are safe. It's part of their scope of practice. And so in that role, that's where the conversations really began with me. I am currently retired, but pursuing my passions, including this one. And it's always my pleasure to work with Bruce Alter. Bruce, please tell us a little bit about you.
Well, in case we haven't met before, I'm Bruce Alter. I'm a pediatric physical therapist and assistive technology consultant, and I've been providing services to multiple school districts for about 40 years. But starting this school year, maybe I'm like Deb and I'm failing at it. I partially retired. I retired from physical therapy practice, but I am continuing to provide assistive technology services to the Woodburn School District. And as to this picture with one of my former sensei, 90, when he was 90 years old, I trained both Kendo and Iaido, which are Japanese sword arts. And I have to admit that sometimes when work is frustrating, defeating many imaginary opponents with my sword after I get home is surprisingly relaxing.
Good for your mental health. Maybe we should all do that, give that a try. So our objectives, first of all, building relationship with you, that's always a given, but making sure we're on the same page as far as common vocabulary, understanding the common why. There's several prongs to that. We want to share just a little discussion about how we came to develop the PEAP in our group of therapists. And Bruce is really going to show us that these conversations have been around a long time. They go through cycles and he's been part of them for a number of years. And so he's going to tell us some of the things he's seen and the lessons that he's learned. We'll take a dive into the PEAP and answer any questions that you might have and any questions in general. So again, common vocabulary, really the main one is the PEAP, the Personal Emergency Accommodation Plan. And originally this started out as emergency evacuation plan, but for clarity, not all emergencies include evacuation. So this is the PEAP, a form that is used to help identify the needs of a student. They may already have an individualized education plan or a 504, and these are well thought out plans that help to know how to meet their needs when it's necessary. So when we think about why, we know that there are 43 million Americans who have a disability. That group goes across all demographics. It could be that you have a diagnosed disability that's been around for a while, and it could also be that in an emergency, you might be someone who's been injured and now has a temporary disability. So the sheer numbers of people who need to be considered in emergencies is part of the equation. And here in Oregon, we have 15% of our K-12 students. That's 15% in public education have a documented disability. So if you put yourselves in the shoes of any one of those 43 million Americans, imagine there's an emergency, and historically the historically and hysterically, the plan has been to leave a person and somebody's going to come for them. Sometimes it's outside of the elevator. Sometimes the plan has been to leave them in a stairwell and somebody's going to come for you. And so just imagine being in a wheelchair, having no mobility of your own, or having communication challenges where you really can't make your needs known, and having just the sheer terror of being left in a spot. These are some of the reasons, the why. It could be us at any point, but we want to make sure that our conversations start early. We know that students have a right to equal egress during an emergency. We know that districts have an obligation to be prepared. Students need to know that somebody's looking out for them. It's also part of their civil rights. So the things that we make sure that we consider, until you start into these conversations, it's hard to really know all of the talking points and the things that need to be considered. But what about a service animal? What if I use an Alcom device? What if I have sensory needs that are so crucial to help me to get through these times? We have a right to know that. As far as another why, of course, we're talking about obligation and the law. And we have a moral, ethical, and legal responsibility. And I'm not going to read these out. You're very familiar with IDEA, where provisions for emergency planning need to happen. ADA includes making accommodations in emergency plans and ensuring access. So we're all here and we are all bound to make sure that our kids are safe. The story that I mentioned about a person being left in a stairwell came from a mother in Maryland who really went to bat and was hoping that that wouldn't happen for others. The link you see on this slide, and you will have access to these slides. The slides are accessible so that all images have tags behind them for those who use alternative access. But Wright's Law is what they've done in Maryland and advocated for and getting laws in place. And at the schools in Maryland, they also now have in their IEP for students, does this student require accommodations in emergency planning? So that's something that as our group, we kind of were hoping that that's where these conversations would lead. So the therapists, as I said, it is in their scope of practice to be concerned and work with students in ensuring that they can navigate during emergencies. Some of those therapists that we had in our focus group said, well, it's all up to me. I don't have a team and we're not talking to anybody. It's all up to me. And you can imagine the challenges of making sure that everybody knows about the plan and their role. Single personnel being responsible is not the correct approach. Emergency pre-planning is imperative. Again, we don't know all the things that we need to consider until we start talking about them. It's amazing. You can't have the reunification bus on the other side of that ball field in the rain. The student in the wheelchair is not going to be able to navigate. So pre-planning and writing it down and making sure that all of the voices are at the table when we're making these plans. So the vision that we had in bringing these back around, and Bruce is going to tell you some of the previous stuff, but this is what really rose it to the top of our conversations and said, we need to do something. And so the vision was that all kids would be safe. So I'm not going to go heavily into the development of the PEAP on this slide. If you click on the title, Development, you go to, it's an overview of the conversations where it came up in our learning team. We pursued it. We brought in experts. We created recorded webinars from people across the country to support this initiative. And so the documents that people were using inconsistently across the state, we pulled those together and kind of made what I lovingly call a Frankendoc, put together all the best pieces and share them. So you probably have some documents that you're working on, and feel free to share those with us as well. But all of those came together to form the PEAP. And then our therapist started using them across the state to give a little street cred and vetting, and Bruce is one of those people. We partnered with ODE and with Alex's team, looking for how do we get the word out about the work that we're doing. And we are so grateful, and this is the way it's supposed to happen. We have conversations, we develop something, we're all on board, and now it's part of ODE guidance. So we love to be able to share those lessons learned. And so we're going to dive into the PEAP in just a moment, but for now, I'm going to stop sharing, and I'm going to ask Bruce to please start sharing
I will be
and tell
happy
us
to.
what you know about emergency planning in Oregon.
Okay, you should see my slides.
Yes, sir.
Great. So my father was quite a man. In addition to being a pilot, an expert skier, and able to build just about anything, he drove racing cars from the time he was a young man until he was around 82 years old. Unfortunately, he passed away a few years ago, and while he was in the hospital, he said this to my sister, and I've treasured it ever since. Bruce is the kind of guy that when you ask him what time it is, he tells you how to build a watch. So consider this slide a warning label from my dad regarding my presentation style. Now, more than 25 years ago at the Therapy and Educational Settings, or TIES conference, a large group of therapists met to try and standardize what schools should do when students with physical disabilities were in the upper level of a building during a fire drill or an actual emergency. And there was a very diverse range of actions and training that therapists have been doing across the state. Some were looking into emergency rescue equipment that could be used. Some therapists were actually training staff how to carry students with disabilities down flights of stairs. Others were just trying to ignore the issue and hope that it would go away. The consensus was we needed to get information and make a decision so there was some standardization across the state. Now, after quite a bit of discussion, one of the therapists who had spent time asking about these concerns with the local fire department suggested that we use the zone of refuge or zone of rescue. He explained that some buildings actually had specific areas with additional fire protection where it would be easiest for the fire department to evacuate the students. So the procedure the fire department told this therapist was for the students who were unable to use the stairs to wait in the zone until the fire department arrived, and then they could determine whether it was safe to use their elevator override key or whether the firemen needed to carry the student out of the building, which was something they were trained to do. So this became the standard approach across much of the state. And since rescue equipment that could be used in schools was limited and extremely expensive, this seemed like a reasonable approach. So like other therapists, I surveyed all my buildings. I even checked the blueprints, and yes, it was that long ago they were actually blue, to see if there were designated rescue zones. And in almost every case, even in the newer construction, I found that few of the buildings had such zones. So instead, we identified the closest area to a staircase leading outside and ensured that the principal and special education staff knew that this was the designated spot to use. Then we trained the staff to bring the student to this area and wait with them until the fire department arrived and then determine next steps. Well, many years after this, Deb introduced me and other therapists across the state to the information on developing emergency evacuation protocols for students. And the information from those presentations, especially learning about Lori Scott and her daughter, convinced me that I need to make significant changes in what I had accepted before. Because I became increasingly uncomfortable with the solution we've been using for decades. It was no longer acceptable to me to leave the students in designated areas in the upper levels of the building while all the other students were evacuated. However, with this discomfort, there arose a need to make changes that weren't easy or inexpensive. So I started to work on writing what at that point we're calling PEAPs, Personal Emergency Evacuation Plans, for each student in one of my districts. And we did this for students who were unable to follow the standard evacuation procedure due to their disabilities, and this primarily meant students using wheelchairs. Plans had to cover not only what to do with the students in the upper level of a building, but also to address how to evacuate when the standard routes on the main level were not wheelchair accessible. But I knew this was only a start because without evacuation equipment, we had to continue keeping students in the upper levels during a fire drill or emergency. But we did write those plans to be adaptable in case we could later purchase rescue equipment. I contacted the local fire department and I arranged to go on their school inspections in as many of the buildings in Tigard as I could. And I also spoke to the police officers who were assigned to the school so I could find out from them what would happen in the event of an active shooter, and that would help me better plan for what our students with disabilities would require. I studied what was on FEMA and the Red Cross websites on emergency procedures for people with disabilities, and all this information was helpful, but I have to say that the time I spent with the deputy fire marshal in Tigard was the most enlightening. I would highly recommend that any staff involved in drafting evacuation plans attend a fire department inspection in the building they work in or across the district if they provide service in multiple buildings. The deputy fire marshal I spent time with was terrific. He was very knowledgeable. He taught me a lot about our buildings, and I learned a great deal, including how much more difficult it was for the fire department to get in our newer buildings because of how the entryways had been hardened to prevent school shootings. The deputy fire marshal also shared the heartening news that there had been no casualties in school fires in Oregon since the 1920s. And he said that modern construction materials and sprinkler systems had greatly increased safety. Now, as I mentioned, I was very uncomfortable that our students with disabilities were still being left in buildings when on the upper levels because we didn't have evacuation equipment. So I investigated the different types of evac equipment available, and I looked for a single type that would work well for as many of our students with disabilities as possible. And I determined that the EvacuTrack CD8, which is what's in the picture here, was the best choice for both my districts. And this was for a number of reasons. Excuse me. They use a completely mechanical system that does not require electricity. Their automatic braking system meant that smaller staff could safely get larger students out of the building. And because of the design, and you can see the many straps, it could be used with almost all students. Now, there were some students who, because of their weight or being medically fragile, weren't safe to transfer into this equipment, but they were the rare exception, and we wrote this into their emergency plans. Although I didn't know how we would get these funded, I found a local company we could order them from, All-in-One Mobility, and I started getting price quotes every year, so I was ready if the money was there. So when the special education directors in each of my districts said they had some additional funds available, I was immediately able to provide them with a price quote and information as to why this equipment was needed. My assistant and I went through every school in Tigard, and I went through every school in Woodburn. Based on the information we had learned from the deputy fire marshal, we determined the best location or locations for putting the EvacuTrack. So we looked for locations in each building closest to a stairway that, whenever possible, exited to an accessible area outside the building. This wasn't always straightforward, and it took some diligence. And in some buildings, they needed multiple units because of the way the building had been renovated. In fact, one of our high schools actually required 3. I think I would have put in 4 if we could have had the funds for it. Then I put this information together in a PDF, and after the equipment and storage boxes were purchased, I gave that to operations, and in both my districts, they were able to get all the equipment installed in only a few days. Of course, the equipment wouldn't do any good without training staff how to use it. So I did everything I could to help the staff feel comfortable when I did the training. The watermelon helmet was, of course, not needed, but it made the staff laugh as I explained how perfectly safe this was and then put the helmet on. Later, I added this shirt. Let's see if I can get it to show. It says, whoops, sorry. That says crash test dummy. Um, that helped as well. I was always the first one in the EvacuTrack, and whenever possible, I picked the smallest staff member to be the one to bring me down the stairs. And after I broke the ice, most of the staff were eager to try it. They especially enjoyed when the principal would show up and they would bump him or her down the stairs as roughly as possible. In fact, I heard from many of the principals and the staff that it was the most fun in-service they'd gone to. I guess you don't always have a chance, maybe with a water dunking, to get even with the principal. So I want to finish my portion of the presentation by going through some of the things that went wrong so you can learn from them. When I used to mentor new physical therapy graduates, I would tell them if they didn't make mistakes, they weren't learning. And if they made the same mistake over and over again, they weren't paying attention. And sometimes I think I made every mistake possible. So hopefully you can benefit from that. Before we had written emergency plans and evacuation equipment, we would do staff training on how to get the student into the zone of refuge and then alert the principal and special education staff where they were located. But due to staff and scheduling changes, some students had different teachers each term, and even students who had instructional assistants that went with them frequently experienced staff turnover, making it difficult to ensure everyone was on the same page with procedures. For example, we had trained the special education staff in the procedure to follow in the event of a fire drill or actual emergency for one of our high school students who used a wheelchair. But what we didn't expect was when the fire alarm went off, none of the special ed staff were in the room, and her substitute teacher decided to carry her in her wheelchair down the stairs and asked other teachers and a few students to help. As they were carrying her down, they accidentally dropped her. She was bruised, but thankfully not seriously injured. But the lesson here is everyone in the building, including substitute teachers, needs to know the emergency procedure for our students with disabilities. In one building, I accidentally discovered that there were evacuation plans that had been written by a new nurse, even though the ones I had created had been in place for more than 2 years. Now, it was the nurse's first year in the district, and none of the special ed staff mentioned to her that students already had evacuation plans. The nurse's plans were actually quite different because she didn't know about the rescue equipment or many details about the student's specific disabilities. Now, I'm going to talk about district administrators' role in determining this and other key aspects of emergency planning in a few minutes. In another case, I had an assistant principal who became very upset when I contacted staff to arrange equipment training. She didn't know I was the one who had secured the evacuation equipment and mistakenly believed it was the building's safety committee's responsibility to provide the training. Eventually, I was able to clarify the situation and have operations send out a letter I wrote to explain who was responsible for evacuation equipment training. Additionally, all staff needs to know where the electronic version of the plan is stored. Since most of our students, the plans were on IEPs or 504s, I use the district synergy system and attach the plans to those documents. But one administrator thought they should be stored where the general education teachers would find them. So I ended up working with the IT department. We created a category and a tag for these plans in Synergy, and then I moved all of them into the new section in the data system. The goal was to make them easier for staff to find. However, I'm no longer in that district, so I'm not sure how effective this was, but the main point is that someone at an admin level needs to decide where the plan should be stored in the district data system so everyone knows how to locate and hopefully read them. When one of our elementary schools had smoke in the building, staff needed to evacuate a student who used a power wheelchair and was on the upper level. We had trained the assistants who were with the student how to use the equipment, and the assistant who was with her at that time was able to instruct the teacher who was in that area how to help her. So everything worked. The student was evacuated, but we realized we had a hole in our training plan. After that point, we started inviting the teachers whose rooms were close to the evac equipment to attend the trainings we were doing. And without exception, every time we invited those teachers, they would stay after school to attend. We discovered they'd been wondering what those beige boxes attached to the walls were for. And they were grateful to see it could be used to help our students get out of the building in the event of an actual emergency. Now, I started addressing the evacuation needs of our students in wheelchairs more than 25 years before this was addressed at a district level. I'd made multiple attempts to get evacuation equipment put into specific building safety procedures for each school, but I didn't have any success, so I finally gave up. I ended up doing the evacuation planning at the individual building level with special education staff as the primary contact. I always emailed the building principal with this information and offered to have them go on tours of the building with me, but this was hit or miss. And since we didn't have a formal district safety manager for many years, these plans were not coordinated with district procedures. Giving up on communicating with the district and building safety committees was a big mistake, and I really regret it. Now, at the administrative level or special education director level, staff must understand that if a student has an emergency plan, it needs to be provided to those working with the student. And this includes giving it again whenever there's staff turnover, which I'm sure you all know can happen quite frequently. Case managers should ensure that the emergency plan is reviewed during each IEP or 504 meeting. Now, if the physical therapist is responsible for writing the plan, they're probably present at the meeting since they provide related service for the student. However, if the nurse or another professional is the author, they should be invited to the meeting so they can review it with the team. Now, there's no way around it. If we're going to do the right thing, which means being prepared to evacuate students from a building, equipment needs to be purchased. The EvacuTrack CD8 that I showed you are about $3,000 to $4,000 each. The metal storage cabinet that stores them, and I think is really essential, is about $500 to $600 each. Now, I realize this is a significant amount of money, but keep in mind you don't need to upgrade every building at once. You can start with the buildings that has the most students with disabilities on an upper level and then do a few buildings each year. I've included information about the equipment I used and the local vendor in the references, and I'll share a QR code for this and other information at the end of this presentation. I believe almost all the mistakes I made were because I made decisions, put plans in place without involving district level administrators in some key decisions. Now, let me be clear, they knew what I was doing and what my recommendations were. So it wasn't like this was some, skunk works project. But at the time, since I'd been doing it for so long on my own, they weren't involved in the decision-making process beyond authorizing the purchases. It is crucial that district admins emphasize that any student who cannot follow the same procedures as their classmates during emergencies such as evacuation, active shooter situation, earthquake, or other crises needs a personal emergency plan. And at the end of our presentation, we'll be providing a QR code with some resources. Uh, Sorry, I've got some other things here. The administrator should determine who will write these plans. I think in many cases, the physical therapists are the best choice, especially for students who use wheelchairs. The physical therapist has already been working with staff on doing transfers, and they're familiar with the equipment. But all staff, including nurses, counselors, and principals, need to be included so they understand who's doing what. And this will prevent duplication of effort and potential confusion. Administrators need to find funds to put rescue equipment in a building. We shouldn't wait until a family sues the district because their kid was left in a building while everyone else was evacuated, or before there's a question from staff who are concerned for their own safety when we're asking them to remain in a building during an actual emergency to stay with a student. There needs to be clarity from the administration that staff must be trained to use the evacuation equipment, and the equipment is only used in the event of an actual emergency. So I hope you can see from the mistakes I made how important it is for district admins to be involved in the emergency planning process. Some key decisions can only be made by those at the administrative level, and this is why I jumped at the chance to speak to this group when Deb contacted me. Now, I mentioned earlier that we have some resources that'll be referenced by a QR code at the end. One of them is a detailed to-do list for district admins who will be assisting with emergency evacuation training. Hopefully, it'll provide a solid framework for you to use when planning emergencies involving our students with disabilities in your district. And now back to Deb. Thank you very much.
Okay. Thank you so much, Bruce. As you hear and you think about the themes in Bruce's conversation, I think that communication among members and building relationship are key. Some of the best progress in Bruce's stories is when he came together with people in the community, emergency folks, etc., and they did some problem solving and came up with some really good solutions. That's what happens when you begin these conversations early and make sure people are at the table. So with all of those ideas and things that Bruce just talked about, we're going to take a bit of a walk through the PEAP, the Personal Emergency Accommodation Plan, and just talk about the parts and some of the look-fors and aimed or fueled with the things that you really need to be watching for that could go astray. So the first page, the first part, of course, is information about the student, the individual. You'll see it says school year and term. And as you can imagine, this needs to be updated every time a student is in a different, maybe a different building for their classes, maybe working with someone new. So this is not a one and done. This is updated over time. We did add a spot for the learner photo in an emergency. It will be helpful for emergency personnel to know who it is that they're looking for. If all plans went well, if a student has and let's say an aide that works with them, that relationship continues on. But we know that things happen and people get separated. And so just making sure that anything that can facilitate in an emergency situation, that we can put it here in our plan. So who are the primary individuals who need a plan? Well, we have here some of the primary areas, also knowing that when you go into the guidance put out by Alex's team and ODE, you're going to see other scenarios. But these are the primary ones. Those who have difficulty in navigating, can't get out on their own. Maybe they're not ambulatory. Maybe they need a couple of people to get them in a wheelchair, etc. Is a student able to follow procedures, comprehend alerts? Are they able to self-evacuate? And so often we know that our students with disabilities have been given somewhat of a bye during drills because of the sensory issues. But what happens then is that they have nothing in their memory bank and that in how to work with and how to deal with. And then the team may not have any idea how that person's um, going to behave in an emergency. So we may not take all of our students down those stairs with Bruce in his evacu chair, but they do need to be part of these conversations. Are they able to communicate effectively in an emergency? I know that could be for someone who uses augmentative and alternative communication, but it also could be someone who has English as a second language, a multilingual learner. So if any of these areas, then you really need to step back and think about these things in advance because they won't happen if you don't. Who are the responsible people? The personnel responsible for coordination. We have here who's the backup. Sometimes it's necessary to say who's the backup to the backup. Knowing and creating these plans and really giving thought to it. And what is the method of communication? When we're talking about reunification, are there things that we need to know with respect to the family and communication? So who is responsible? We looked at some of the pre-activities and getting things ready and the PEAP, all of those pre-activities of building your team and coming up with procedures and having oversight from the administrators. Those are the things I would call pre-activities too, making sure that you are giving this thought and have the foundation in place. But looking at developing the plan, adding it to the IEP or 504. When you did that, making sure too that, as Bruce said, where do these things live? Where do they stay? If it's in the IEP, then does a gen ed person have access? If it's in the IEP, what about our community emergency personnel? How are they going to get access to it? So when is it shared? And then you'll also note here the go bag. What does my student need in an emergency? So as we have here, contact information, medical information, including additional medication if they should uh, be, um, be without for a bit. It could be batteries for backup for their communication device. It could be a printout of their communication in the event that their device gets separated. But giving all of this, and where does that bag live? Is it always going to ride on the back of their wheelchair? Is it placed in a locker area? So all of these things that really need to be considered. Bruce mentioned training. Everybody needs to be trained. And as soon as a team member changes, making sure that everybody is in the loop and that that training is ongoing and documented. So this is the page. The emergency procedure plan is where you really get into the nitty gritty of what needs to happen. What is the mobility equipment needed? Where is it located in this building? If this is the only building the student is in, then this is the primary location. But what about when they're in a different building? Again, just making plans and contingency plans and looking at their ability to help. If they are completely reliant on somebody, that needs to be noted. What are the risks, the considerations? And in an emergency, we've also heard stories about people who are unable to really communicate their needs and coming in contact with the emergency personnel who don't really know how to bridge that gap. It could be that some of the training we're talking about is with our local emergency folks in helping them to know how to work with people who use alternative devices. Now, as part of Alex's trainings, the community planning, it's ideal whenever the community is part of all of these conversations. And so the training really needs to extend there. May even be thinking of what about the bus driver? How does the bus driver know how to work with these students? And do they have the straps that are necessary? So again, so much that needs to be documented. So the next spot you see is what the type of emergency, evacuation, lockdown, etc. What are the potential barriers for the individual? What needs to happen? And who is responsible? So just taking apart and just imagining uh, what if there is a truck overturns and there's noxious gas coming into the school? What are we going to do? So just really thinking through those scenarios. And from my folks, my friends in emergency response, they say that the reunification piece is one that is often just kind of iffy and not really thought clearly out. So making sure that where are those points, and did you talk to the family about where they will get together again, and when was that decided? And any supports that they may need. Somebody who might have sensory issues may need to have social stories. This is how my student really responds and can relate to the things that are necessary. And some are going to need counseling, could include us. So the plan is to be reviewed anytime that there is a change. Again, making sure that it is up to date and that the right people have a copy of it. If you look here at the distribution, the principal, of course, they may not be the one who was helping that student directly, but you never know, it could be them. They at least bare minimum need to have an awareness of where these plans are. The classroom teacher, any support staff, the parents, guardians, again, making sure that everybody knows. And like I said, I think I'd add the bus driver here. So really reviewing it, going over it and documenting it. In the event that something happens and you weren't prepared, you can demonstrate being prepared by having all of your ducks in a row and everything documented and reviewed. And it may take a little bit of time, but your IEP meetings are a great time for these conversations. So in summary, for now, we know that it is crucial to plan ahead. You don't wait until things are happening to consider. And making sure that you have all of those voices at the table, including administrators and therapists and anybody who really knows that student. So we talked about our common why being because it's the right thing to do. We talked about it being because it's the law. But we also talk about it from a financial standpoint. The lawsuits, the things that could happen if you're not planning. But the cost for the lack of planning goes way beyond that and becomes unimaginable when you think about what could happen without these conversations.